Use of urgent care clinics in portal of entry care setting has been growing rapidly in the United States and especially grew during the COVID pandemic. Along with this rapid growth, the use of telemedicine services has also grown with the greater acceptance by the public and healthcare providers. During the pandemic, avoiding the ED has become an important step in preventing the spread of the highly contagious COVID virus. By utilizing UCC and telemedicine services, it greatly minimizes the exposure risks. Telemedicine certainly has some limitations as it does not allow for physical exam and lab or diagnostic tests, but it is a valuable way to triage a patient in order to determine if they should seek primary care in person or NED. Given that many conditions can be triaged in this fashion, many patients will not face the inconvenience of having to make a trip to the UCC or ED. It has been estimated that each ED visit that is avoided saves about $1,700. Studies have shown that both patients and healthcare providers have an overwhelmingly positive experience with the use of telemedicine. With insurance carriers becoming increasingly willing to reimburse for these digital services and facilities integrating these technologies into their workplace. The adoption and willingness of both clinics and patients having favorable experiences has resulted in a rapid growth of telemedicine usage. With any new process or technology, there always lies the possibility of downside that has to be addressed. Telemedicine has the ability to make it far more convenient and accessible to those populations that live in remote areas, underserved populations, and to those patients with disabilities that make visitation more problematic. However, these same populations tend to be those who experience the greatest disparities and inequities in healthcare. They also tend to be less urban and of lower income and educational status. These populations, way more than urban higher income populations, tend not to have access to those technologies required for telemedicine services such as internet, mobile phones, computers, and more technical savvy education to manage such digital devices. That risk then are the use of telemedicine could worsen the digital divide and result in even greater healthcare disparities and inequities. That's in order to overcome these unintended consequences. Concerted effort must be made to invest in the digital infrastructure and digital education in order to avoid these populations from falling even further behind in the advances of healthcare accessibility. UCC has improved an easier portal of entry for patients to obtain healthcare. However, when these facilities and smaller hospitals are located in underserved areas, they tend to have lower volume on patient visit, and it makes it more difficult to budget for the initial and monthly cost of telemedicine integration. These costs can be $17,000 to $50,000 to start, and up to $60,000 a year. Higher volume urban UCC have a greater ability to absorb these costs. Thus, once again, creating the digital divide in the inequities and disparities in healthcare. The use of telemedicine technology will only continue to grow, and we must make a concerted effort to fund the build out of the digital infrastructures that can make this service available to all populations, including those most likely to fall further behind in the digital divide.